Diane Henry, and in the next 30 minutes, we're going to share some powerful stories and information about nutrition and how it affects our fertility, our pregnancies, and our children's health, along with our grandchildren's health. So I'm a pharmacist and a certified women's health and food over medicine instructor, and have been teaching about nutrition for 5 years now. I became passionate about nutrition and the role it plays in our reproductive health 6 years ago, when I was at my annual OBGYN appointment and realized I was 32 years old and wanting to start a family. I knew my diet just was suboptimal, as I was eating a lot of processed foods, junk foods, and high-fat foods, which prompted me to start studying about nutrition and the role it plays in our overall health. I decided to cut way back on animal foods and started juicing as a way to incorporate more whole foods into my diet. And I quickly found myself super burned out on juicing, as it was very cumbersome, time consuming, and quite costly. So shortly thereafter, I was newly married. I found out I was pregnant, and I was tired. So I had been also suffering from chronic pain and swelling in my knees, and worried about whether I was getting all the nutrition I needed. I've always been an athlete, love being active, but a lifetime of sports injuries and knee surgeries had me feeling totally debilitated in my early 30s. And then God answered my prayers when my sister Erin, who's on here, shared the pregnancy research with me. And being a pharmacist and a research enthusiast, I was blown away with the body of research that had been conducted on Juice Plus. So I quickly went from a skeptic to all in. My energy went through the roof. My pain and inflammation dropped. I had 2 active pregnancies, deliveries without complications or medications, and our doula thought our boys were over 10 pounds because the placentas were so thick and healthy and large. And our boys were born at 8.4 and 8.9 pounds respectively. So I'm going to turn on my PowerPoint because I just realized I don't have it on. So I'm going to do that now because I have some slides to go along with this. And I'm going to try to share my screen. Oops, go back. Tell me if you, let me see. Sorry, I'm doing this from my laptop because we're traveling, so I'm not as smooth with this. Here we go. Share screen. I'm glad I remember that. I was like, crap. Okay, here we go. Can you guys see everything? You see that picture?
Yes.
Okay. So currently, I live in Hawaii, but we're on vacation in the Pacific Northwest with my husband and 2 sons, and who are healthy toddlers. They've only had 1 sick visit and have never required an antibiotic. And I really attribute the great health that I had during my pregnancies and now, and how healthy the boys have been, to the fact that we've had over 45 whole foods streaming through our bodies every day since before they were in the womb. So we will never go a day without Juice Plus in our lives, because it has been the one simple change that we're going to talk about later that has helped us to be as nutritionally fit as possible amongst the craziness of life. So we're going to start off today with a few definitions. Fertility is the natural capability to produce offspring, and infertility is the ability to achieve, the inability to achieve a clinical pregnancy following 12 months of regular unprotected sexual intercourse. And women who are greater than 35 years of age have a 6-month duration, independent of anything else based solely on their age. So we're aware that infertility can be a very sensitive and personal topic. And so I want to respect everyone's experiences while also providing meaningful information tonight. And we know this is not an all-encompassing presentation on these topics. So if you're struggling with any of these issues, we just want to love and support you and help you through the process, and hope that you can find something helpful from this. So infertility does affect an estimated 15% of couples worldwide, and greater than 6 million children have been born from assisted reproductive technologies globally. 35% of infertility is due to problems within the female, and 30% is due to problems within the male. 20% is due to problems within both the male and the female, and in some cases, 15%, there's no cause that can be found. unfortunately. So why is this occurring? Well, one of the biggest factors impacting fertility is being overweight or obese. In America, the prevalence of obesity in 2016 was 40% of the population, so affecting 93 million adults. And sadly, we are living amongst an obesity epidemic right now. Americans, in particular, are growing increasingly obese. This slide shows what the obesity prevalence was in American adults in 2016. The green dots indicate less than 20% of the adults in that state are obese, and it just goes upwards from there. So in the last 30 years, America went from having 12 states at less than 10%, and they had to actually change the legend to less than 20%. And now there aren't any states that fit into that category anymore. So red indicates that greater than 35% of the adults in that state are obese. And sadly, it's easier to count the number of states that aren't overweight than those that are. And so some other interesting statistics I found was that, as of 2016, greater than $10,000 per person per year is spent on medical expenses in America. And this means that roughly 1 in 4 adults are obese, which leads to an increased risk of diabetes, heart disease, strokes, arthritis, depression, and you guessed it, infertility. So when we're looking at the impact of being overweight on fertility, we see there's a direct correlation between an increase in body weight and an increase in infertility. We also know that fat is inflammatory. So fat and inflammation produce a wide variety of inflammatory mediators in the body. And as a result, the semen quality is poor, and the amount of oxidative stress and DNA damage that occurs in the sperm significantly increases. Overweight men also have a decrease in their sperm production due to hormone imbalance. So peripheral fat will actually turn testosterone into estrogen, and this estrogen then feeds back to the brain, shutting off the drive to produce sperm. Likewise, there is good evidence to support that overweight and obese women are far less likely to conceive and far more likely to miscarry by up to 30%. So there's a much higher rate of recurrent early miscarriage in overweight women. And they've also found that in overweight women, the follicular fluid contains an increase in insulin, lactate, triglycerides, and C-reactive protein, which are all inflammatory chemicals, setting up a really poor follicular environment, which can lead to poor egg quality and poor embryo quality. So the sad thing about this is that these negative effects can carry over to the next generation, with there being evidence of fertility problems in the offspring of these overweight parents. So when we're talking about the impact of nutrition, we're talking about the quality of cellular health. So the quality of the cells that make up our eggs, the sperm, the embryo, the endometrial environment, the lining of the womb, and where the embryo is going to implant. These are the clusters of cells that change throughout the month and renew each month. And that's actually good news. During conception, we experience the sudden rapid cell development. And if we have an excess or a deficiency of a certain nutrient during a critical period of that cell development, it can affect how well the organs are formed and how well the body will function now and in the future. So our reproduction and cellular health is ultimately impacted by the environment and nutrition. So today we're focusing on the nutrition component. And I love this quote: every time you eat or drink, you're either feeding disease or you're fighting it. And it's so true from what I'm learning. The famous Harvard nurses study was one of the largest longitudinal studies done on women, and it looked at dietary patterns of women who were fertile versus those who were infertile. In this study, they followed 18,000 women who were trying to get pregnant for 8 years and measured what they ate. They found that the meat intake was associated with infertility, and adding just a single serving of meat per day was associated with a 30% greater risk of anovulatory infertility. While animal protein was associated with increased risk of infertility, consuming protein from vegetable sources had the opposite effect, so protecting and improving infertility. So basically, if you replace those animal sources of protein, or, those either the animal sources or the protein, with vegetable sources of protein, like beans, you can reduce the risk of infertility because of ovulation or failure to ovulate. So next, I would like to introduce Callan Edick. I met Callan through a friend, Caitlin Russell, when she shared her inspiring story with me. Callan's story brought me to tears and impacted me so much that I wanted to see if she'd be willing to share with us today. And thankfully she said yes, and joins us today from Navarre, Florida. She's a busy mom, realtor, and military spouse. So we're so excited to hear your story, Callan. So go ahead and unmute yourself and take it away. I can't hear you. I can't hear you yet, Callan, if you're talking.
Hi, Kat.
Hello?
Can you now?
Yes.
Okay. Hey, let's try this. Sorry. Okay, so let me start over. So hi, I'm Callan. I am I'm a mom of 4, proud mom, stepmom of 3 girls, and mom of little Declan, that's who I was pointing out, is on the wall behind me up there. And the reason that I'm here talking to you today. So when we decided that we were ready to start and have a family, I pretty much dove straight in and, read all the research, and because obviously, what to do, but I wanted to know when to do it and fully understand conception, because that's the type of person I am. And I was like, okay, I've got a timeline, and this is when we need to get pregnant because this works out best for work. And, in my head, I knew exactly what I wanted to happen. And it didn't work that way. And, like you said, it's a sensitive topic, and people don't always talk about it because it is so personal, and it's so hard when it doesn't happen when you want it to. And we went through that constant cycle of hope and disappointment. And I went back and listened to my Voxer thing that I had originally done that you were talking about. And I listened to it today, and man, I was just crying all over again because it took me straight back to that place. And I was 8 weeks pregnant when I did that. And now Declan is 14 months old and just a tornado of destruction in the best way possible, and just the healthiest little boy. But we went through, it was almost 2 years of that struggle. And I first went to my doctor at 9 months and did all the tests. And my husband got tested twice, and just kind of in a nutshell, he did 2 different tests on base for him. It came back that there were issues with his sperm mobility. They couldn't find anything wrong with me. We got referred to an infertility specialist, and it was the craziest thing. We're sitting there in the first consultation, and he's giving us a packet of stuff that he wants us to read over. And then he says, and I want you to look into this thing. It's called Juice Plus, and I really recommend it. And I've seen it do amazing things with my clients and with my family. And here I had Katie Russell, who was in my ear over here, sending me this stuff on Juice Plus and related to fertility. And I was like, okay, Katie, okay. And here I am, in the office, and I was like, man, maybe there's something to this. And, long story short, we both got on it. My husband went back for tests afterwards. After he started taking Juice Plus, his test came back totally normal. And that was after 2 rounds of tests that his numbers were way off. And they started me on Clomid and then Femora, and no luck, constant hope, disappointment. And then all of a sudden on a down cycle, when no meds, no anything, I got back on my Juice Plus after getting really frustrated. And before I knew it, I was pregnant. And gosh, what a blessing that was. And I wasn't even taking my prenatals at that point. The only thing I was on was Juice Plus. And I know, no doubt in my mind, especially after going through my pregnancy, I had an incredibly healthy pregnancy, healthy baby boy, 13 successful months of breastfeeding. He takes the capsules now, and I've been taking it all the way through, and he's never even had a fever in his life. He's never even had an ear infection, anything like that. It's just been incredible. So that's just a little bit of my story. I don't know if you had any questions for me, but it's changed our lives. And so my husband takes it, I take it routinely, Declan's on it, and then my stepdaughters too. And it's been
That's
amazing.
Thank you so much. That's like, I'm so glad you re-listened to it, because I think I've re-listened to it multiple times. It's super powerful. If anybody wants to hear the full version. Thank you so much. So we have a lot to cover, so we're gonna get through them as much as we can. But the next part we're gonna kind of touch on is pregnancy. And during pregnancy, our bodies experience a lot of changes. So first off, our immune system is suppressed, and the worse our nutrition is, the worse our immune system is. Have you ever noticed how once somebody gets sick during their pregnancy, they can't seem to quite get over it? I've seen that before, and that's because the body is so focused on growing the baby that our immune system essentially gets put on the back burner. And so during pregnancy, we also are at an increased risk for diabetes, known as gestational diabetes. And it usually goes away after the birth of the baby, but those who do get gestational diabetes are putting their babies at an increased risk of diabetes down the road, as well as preterm labor or having a larger baby at birth, which can make the birth more difficult. Our cardiovascular changes are also phenomenal when we're pregnant. By the end of the pregnancy, our heart has enlarged, our blood volume has increased by 40 to 50%, our pulse increases 10 to 15 beats per minute, and the amniotic fluid, which is surrounding the baby at all times during the pregnancy, is continuously being regenerated and renewed. So without proper nutrition and antioxidants, which help to keep our oxidative stress down, we're at an increased risk of preeclampsia. And preeclampsia is the sudden onset of restriction in blood flow, causing a reduction in blood flow to all the major organs, including the placenta, which is the lifeline to our baby. When the mother experiences preeclampsia, which is also known as high blood pressure, the baby is oftentimes delivered preterm at a low birth weight and will experience respiratory distress syndrome because of underdeveloped lungs. So this is why we really need to take care of our bodies and ensure our nutritional health is as strong as possible to make sure there is good circulation in the placenta and we're able to avoid as many of these complications, if not all of them, as possible. So what is proper nutrition? Well, we know based on the research that a diet rich in fruits, vegetables, whole grains, and legumes are not only great for pregnant mothers, but for everybody. And alpha-linolenic acid is the essential fatty acid that we need for brain development of a fetus. And our needs are 2 times greater during pregnancy. So, and it's important to note that too much intake of omega-6 fatty acid, which is also found in animal foods and processed foods, can interfere with the conversion of alpha-linolenic acid to DHA and EPA. And this is important to take note of because back in the Aboriginal days of time when there was cavemen, the ratio of omega-3s to omega-6s was 1-to-1, which that's what we want. Well, now the ratio of omega-3s to omega-6s in the average person is 1-to-17. So when I heard that, I was like jaw drop kind of thing, because that's pretty significant change. But the consensus guidelines recommend that women who are pregnant should consume an average of 200 milligrams per day of DHA during their pregnancy. And this is why they do that, because women need to supplement that DHA, that omega-3, in order to get that ratio closer into balance. And vegan mothers also need to take a vitamin B12 supplement. So proper nutrition during pregnancy will help us keep our immune system strong. It'll help us fight disease, fuel and heal our bodies. It also increases the likelihood that we're going to have healthier babies and decrease the risk of getting gestational diabetes, that high blood pressure we talked about. It will decrease the interventions that are necessary during pregnancy and labor. And it will also relieve the constipation that can affect many women during pregnancy. Okay, so the reality is most people are consuming the standard American diet, which means that we're eating too much junk. So processed foods make up 70% of the United States diet, and Americans spend 10% of their disposable income on fast food. The average American consumes 130 pounds of sugar per year. So in the last 20 years, the number of overweight kids has increased by more than 50%. And this is one of the first generations that we're actually growing babies on processed foods. So we have mothers that are getting pregnant, they're eating fast food for meals, sometimes more than one a day. They don't have time to sit down and make a well-balanced meal. And this is going to affect our generation and our future generations to come. So what do we do? Well, the recommendations are that we're supposed to be eating 9 to 13 servings a day of fresh, raw fruits and vegetables of a wide variety. When we're trying to conceive or when we're pregnant, we want to eat closer to 13 to 15 fruits and vegetables every day to meet the demands of our body. But it's just not that simple. So to complicate things, we have soil that is depleted, and the nutritional content of our food is just not what it used to be. So the CDC realized, or basically found, that 1 in 10 adults are actually meeting the fruit and vegetable recommendations in America, and only 7% of children are consuming 3 servings of vegetables a day. Almost everyone, that means almost everyone, needs to eat more fruits and vegetables. And we know that a diet rich in plants is not only good in pregnancy, but it also reduces our risk for heart disease, stroke, cancer, diabetes, and being overweight or obese. But we're not doing it. So why do we need so many fruits and vegetables? People wonder. Well, when we breathe, we walk, run, or do anything, our bodies are breathing in oxygen, which leads to free radicals. These are unstable compounds that lead to aging, disease, and death. We make billions of these every day, and the only way to slow them down is to neutralize them. And the only way that we can neutralize them is by consuming a lot of fruits and vegetables that contain antioxidants, similar to an apple and the picture of the apple or the picture of the skin. When you put antioxidants on it, like lemon, you can slow the aging of it, or the browning of it in this case. In consuming fruits and vegetables, we get protection from free radical damage and oxidative stress. So if over 90% of us aren't eating enough, then what do we do? Well, we've kind of talked about it already a little bit in our stories. Our family takes Juice Plus. Juice Plus contains the nutrients from over 30 fruits, vegetables, and berries that have been vine ripened, juiced, dried, and encapsulated. And it's an excellent way to bridge the nutritional gap that exists between what we eat and what we need to eat. So unlike vitamins, Juice Plus has nearly 40 studies that show our bodies are receptive to absorbing the nutrients. It also shows a decreases in inflammation, oxidative stress, fat storage, DNA damage, and improves insulin resistance, gum health, heart health, immune system function, skin health, lung health, and overall quality of life. So that's amazing. And when we talked about so many of those things being what happens with not eating enough fruits and vegetables, it's just impressive that we have the research that shows this helps. And the research on multivitamins has shown no benefit. And in many cases, it causes harm, which is why I chose to use Juice Plus exclusively during my pregnancies. And in addition, there was a recent study of 9 prescription prenatal supplements indicated and 6 of those failed to meet the USP standards for folic acid dissolution, which is one of the primary reasons women take a prenatal vitamin when they're, well, trying to get pregnant or pregnant. And Juice Plus provides 680 micrograms of absorbable folate, which covers more than what the requirements are needed when pregnant. So most pregnancies, about 50%, are unplanned. By day 18, the baby's heart is already beating, and by day 27, the spinal cord is already closed. And we need folate before we get pregnant so the baby will have it in those critical early days after conception. Most people haven't found out they're pregnant before the spinal column has already closed. And we can reduce the risk of spina bifida by 70% if we have enough folate in our diets. So folate, it also has other benefits. It reduces the risk of heart disease and colon cancer. And folate itself comes from green leafy vegetables and legumes, and it's the best source. Some people will get enough in their diet, but for a lot of us, like myself, there are days where I may be missing out on the required amounts that I need. So it's important to point out here that folic acid as a supplement is not the same as folate, and it cannot be created equally, as it comes with a lot of side effects such as increased cancer risk, bloating, increased risk of seizures, sleep problems, breathing difficulty, and asthma, just to name a few. And there's a much longer list, you guys. I was like, that's enough. But this is why I love the Juice Plus capsules, because unlike a prenatal vitamin, it's a whole food nutritional product that's been independently researched in universities and research institutions all over the world, including UCLA, Brigham Young, Arizona Cancer Center, and it's found to be bioavailable. The Juice Plus Omega blend, which is the orange bottle there, is an excellent source of DHA, and it comes from an all plant-based sources, which avoid those toxic pollutants such as mercury that are present in fish. So for most fish, the brain damage caused by the mercury would exceed the benefit from the DHA, which I found interesting. But some pollutants like PCBs, they can get stuck in our body for decades. So it's not enough just to eat clean during pregnancy. Thankfully, we can get the benefits without the risk by getting the DHA from algae instead, which is where the fish get it from to begin with. And pregnant and breastfeeding moms can cut out the middle fish and get DHA directly from the source, which is at the bottom of the food chain, where we don't have to worry about toxic pollutants. In addition, the omega-3 is a blend. So it also contains omegas 5, 6, 7, and 9 that come from all plant-based sources, which are pomegranate seeds, sea buckthorn berries, raspberry seeds, tomato seeds, and safflower seeds. So Dr. Doug Odom is an OBGYN who worked for over 40 years delivering over 17,000 babies, and he's presented at numerous medical conferences on the topic of pregnancy outcomes. And his research, according to Dr. Rachel Ray, is further evidence that Juice Plus is the Mercedes-Benz of prenatal supplements. And Dr. Odom assessed the effect of antioxidant supplementation on premature labor, preterm birth, preeclampsia, birth weight, and fetal growth. And here is a summary of those results. So 178 patients in both groups, one took a prenatal vitamin while the other one also took Juice Plus. And the Juice Plus group had a 0 incidence of preterm labor, premature rupture of membrane, preeclampsia, 0 admissions to the NICU for the babies, and no respiratory distress syndrome in the babies. And they also had a lower incidence of cesarean delivery, and overall, the Juice Plus group had safer pregnancies and healthier babies, which was really powerful. Next, I'd like to introduce Jess Ott, who is a mom of 2. She's a fitness instructor. She's a teacher who is passionate about prevention and nutrition. And when I first heard her story, I was in tears again and so in awe of how strong this woman is. So thank you, Jess, for being willing to share your journey with us today. And go ahead and unmute yourself.
Cool. Well, thank you for having me. And I just want to share my story and come on here and how it's definitely changed our lives. My Juice Plus story started about 4 years ago, and I'm naturally a health conscious person. I always have been. I've loved fitness. I just felt like I wasn't reaping the benefits from being a healthy person. So we got on the product and became a rep immediately, and we instantly started seeing so many different results that's another story. But something that never came to mind when I started taking Juice Plus was pregnancy and my kids. I never even thought of it because I didn't fully understand what it was. And then once I did, I knew I was at the right place at the right time. So 2 years ago, I was giving birth to my second daughter, and what should have been a really exciting time ended up becoming just a traumatic nightmare. I ended up rupturing my uterus on the second to last push, and that made me septic, and I started bleeding out, and then I was rushed into emergency surgery. Thank God everything went great, and they were able to fix my uterus and everything. But when they went in for the surgery to repair my uterus, they actually found an infection the size of a tennis ball that had been sitting there for over 2 years. The surgery ended up lasting about 3 hours. And as soon as I got back to my room to be reunited with my baby and my husband, my OBGYN and surgeons came in and they started explaining everything that happened. But they were shocked by one thing. They said that what saved me and my baby and all of this and kept us both healthy was my immune system. They said my immune system was so strong that it completely encapsulated the infection for over 2 years, making my pregnancy possible and keeping us both healthy. They told me that they've never seen anything like this in their 30 years of practice, and they asked me what I did to keep my immune system strong. I immediately started smiling because I knew that it was Juice Plus, and thank goodness we have the research to back that as well. But to back up a little bit, I wasn't on Juice Plus with my first daughter. And when I was pregnant with her and with delivery, I ended up gaining a bunch of weight. I got the pregnancy mass. I was swollen. I had sciatic nerve issue. I just had issue after issue after issue with my first daughter. And then issues with her immune system and keeping her healthy for the first couple years of her life, for the first year of her life. And then comparing that to comparing my second daughter, I think I gained maybe 20 pounds. I exercised completely through. I actually ended up being able to have a VBAC with my second daughter. My first daughter was an emergency C-section. I had an amazing labor minus the traumatic part of it. And now both of my daughters are so healthy, and we've actually overcome so many different systematic issues in our body: asthma, allergies, hormonal acne, weight gain for me, with nutrition. And just, it really goes back to how powerful plants are, and it's completely changed our lives for the better, and it will be something we will always take and we always be sharing with others. So thank you for letting me share my story.
Thank you, Jess. So powerful. And I know that there's more to your story as well, but I am never tired of hearing it. It's really a testament to what you've been doing. So I know that we're over 30 minutes, but we're going to just continue on. So if you guys need to get off, it's being recorded, but we're going to finish it out because we got another great story coming. So I'm going to go on to breastfeeding a little bit and just say that the best investment that we ever made during our pregnancy was in the doula lactation consultant who helped me in the moments after labor when I needed it most to be able to have that confidence in nursing. She also came to our home. She ensured that we were comfortable and coached me through the technical skills of breastfeeding, essentially. And so the World Health Organization recommends we breastfeed for at least 2 years. The American Academy of Pediatrics says at least 1 year. And really, the longer, the better. This sets children up for the best possible outcomes in health, as well as other areas such as speech, good speaking skills, teeth growing in the proper formation with lots of space, and many other areas. There is a whole body of research on this that is actually showing that kids that were not breastfed for a sufficient amount of time can end up with higher risks for developing autoimmune conditions, type 1 diabetes, celiacs, MS, thyroiditis, and there appears to be a link, whether it's causational or associative, that not breastfeeding for a sufficient amount of time can actually set a child up for complications later in life. So it truly is the perfect food. That being said, a lot of people can't breastfeed for one reason or another. And donated milk from milk banks is a good option for those people. And also, soy formula is another option. And it's preferred over cow's milk because the children's guts are really sensitive to cow's milk proteins, which is a foreign substance to the human body. Therefore, soy is safe and it's the best thing, second to breast milk. So what about in the older kids? Unfortunately, similar to adults, they're also being impacted by the obesity epidemic. And in the United States, the percentage of children and adolescents that are affected by obesity has more than tripled since the 1970s. Data from the 2015-2016 showed that nearly 1 in 5 school-age children and young people from 6 to 19 years of age in the United States are obese. 91% of American children have poor diets, and 2/3 consume a sugary beverage every day. And this has consequences, unfortunately. Obesity has immediate and long-term effects on physical, social, and emotional health. Children with obesity are at higher risk of having other chronic conditions and diseases that influence their physical health. These include things like asthma, sleep apnea, bone and joint problems, type 2 diabetes, and risk factors for heart disease. And in addition to that, children with obesity are also bullied and teased more than the normal weight peers and are more likely to suffer from social isolation, depression, and lower self-esteem. In the long term, a child with obesity is more likely to have obesity as an adult, and adult with obesity has a higher risk of developing those diseases, heart disease, type 2 diabetes, metabolic syndrome, and many types of cancer, as to those who are not. If one parent has a weight problem, our children are 40% more likely to be overweight. And if our spouse is also overweight, then our children are 70% more likely to be overweight. If you have high blood pressure or cholesterol, your child's risk is 50%, and it's 75% if both parents have that. So as with adults, it's important to eat this well-rounded diet that is rich in fruits and vegetables, whole grains, and legumes. And it's recommended that we start introducing foods to babies at 6 months of age. And that's because the iron stores are all essentially gone at that point. And this is a good time to introduce iron fortified foods such as lentils, which are rich in iron. Beets are also good, and they help the child get that feel or that taste for eating healthy foods as they age, making sure that they also get enough calories. They're still getting that formula or breast milk until at least 1 year. And as they grow up and stop using the breast milk, we also want to make sure that they're getting a vitamin B12 supplement if they're eating strictly plant-based vegan food. And so if you struggle with children not eating enough fruits and vegetables, you're not alone. We actually have an amazing Healthy Starts for Families program where children ages 4 to undergraduate college students can eat Juice Plus chewables or capsules for free. And the results of this family health study have shown that 60% of kids were missing fewer days of school, 56% were taking less OTC or prescription meds, 71% were drinking more water, 66% were visiting the doctor less, 71% were consuming less fast food and soft drinks, and 61% were eating more fruits and vegetables. This is an excellent program to help families cultivate these positive habits. And moving on, last but not least, I'd like to introduce my sweet friend, Karisa. Karisa is a certified Dr. Sears health coach and works as a fitness instructor in Grand Island, Nebraska, where she and her husband, Stan, are raising 3 beautiful boys and inspiring healthy living. So we're excited for you to bless us with your story, Karisa. Go ahead.
Thanks, Diane. Can you hear me okay?
Yep.
Okay, awesome. So thank you for the introduction, and I'm super honored to be a part of the call tonight, you guys. Thank you for being on, and I'm just going to brief you with my story. I'm just super grateful that my best friend, Michaela Peterson, who's a pharmacist and is also on this call, was generous enough to share Juice Plus with me and my 2 boys at the time. I was a single mom of Brock and Bowden near 4 years ago. And I was in a spot where I was needing hope the most and didn't realize it. I thought we were healthy, but my kids were in and out of the doctor's office every other month. And that is no joke. So I really feel like I went from, pumping their bodies and not knowing that it was doing anything harmful or, wasn't maybe the best route, full of antibiotics, to now pumping their bodies full of 50 plus plants a day, which has, in my opinion, been the absolute best health insurance policy a mama could give her kiddos. So they went from in and out of the doctors every other month before Juice Plus to being to the doctor 5 times in 4 years. So huge, huge blessing. And with that too, we've seen their palate broaden. They were picky eaters. They were beige diet kiddos. And to try and get kiddos to eat 7 to 13 servings of fruits and vegetables, in my eyes, is near impossible. So to be able to bridge the gap with this amazing catalyst has just been huge. So then I remarried to Stan, like you had mentioned, and we've seen his high blood pressure, high cholesterol that he had battled for 20 plus years come down within normal ranges. Huge blessing. I've been able to shave a minute off my half marathon split, going from an 8:30 to a 7:25. And then one of the most exciting things too is we had a Juice Plus baby, Baylor. He just turned 2 last week. And I just am super blessed to have been able to have our hands on this, to have this be our sole prenatal. For him, we felt 120% confident with all the research that we were going to use it as our sole prenatal. And, a lot of similarities to Jess, like, my swelling during pregnancy was way better. I was way more active. I had more energy. I was eating more of a wide range of foods. And when I did have my guilty indulgences or cravings, I had good peace of mind at the end of the day that not only myself, but my baby in utero was getting what we needed. And once we had Baylor, my repeat C-section was extremely smooth. I was able to run and be active and my milk supply not go down. And so that was a huge blessing. And then excited to say that we have only been to the doctor for well visits for him and no sick visits. So it's just been a huge blessing. So
awesome. Yeah, your story is extremely powerful, Karisa, on both you and Stan's front and the kids. So thank you so much for sharing with us today. And I'm gonna end this just by sharing. I was going to talk a little bit about nutrigenomics, but I'm just going to share this quote from Dr. T. Colin Campbell in the China study, where he states that genes do not determine disease on their own. Genes function only by being activated or expressed, and nutrition plays a critical role in determining which genes, good or bad, are expressed. So basically what this is saying is that our lifestyle has a huge impact on our health, and it plays a major role. And we can absolutely change what our children become simply by changing our diet before, during, or even after our kids are born. So thank you guys so much for your time. I'm sorry we went over, but it was a lot to cover in 30 minutes. So thanks again for sharing, ladies. It was really awesome to hear them again. So thank you.
Thank you guys so much.